don't know if it does. Ooh.
How many doctors does it take to move a podium?
Yeah, all right. Okay, great. Thank you. So I'm going to just mention who all is here with me today, because it's just a perfect opportunity. We've brought folks together from across the state and country, you know, to discuss public health, but also it's perfect timing given the challenge of coronavirus. I recognize that people are anxious, they're scared, and it makes sense for the community to feel that way. It is a scary situation, it's an uncertain situation, and so I wanted to make the time to share with folks what we're doing, how we're preparing in Harris County, and also remind folks what each of us can do as part of the community. So here with me, I have Dr. Shaw, who is our county director of our public health department, Dr. Purse, who is the director at the city's health department, and they're working incredibly close together in all of this. We also have Dr. Carlos Plasencia, who is with the state's health department. We have George Roberts and Lori Freeman of the National Association of County and City Health Officials, and we have Robert Kirkpatrick and Jennifer Smith of the Texas Association of County and City Health Officials. And so the name of the game really is coordination on this. Today, I've directed our Harris County Office of Homeland Security and Emergency Management to formally stand up at TransStar and bring partners together throughout our departments and, of course, folks throughout all of these organizations to support our public health response, making sure that we are truly leaning as far forward as we can to coordinate and to prepare, with the expectation that this could come to affect us at some point. And so we want to get ahead of it, and we want to make sure that we're formally coordinating. We have worked as well, you know, the public health department continues to monitor 24/7 for any potential cases, for any situation that they may need to do follow-up on. They are being extremely thorough with folks that could be possible cases, making sure that they're getting them tested, that they're running down anyone they may have come into contact with, and following up on that so that we're protecting the community. I want to reiterate a couple of things. First, there are still no cases of coronavirus in Harris County or in Houston. And right now, of course, we don't have a vaccine for it, and so the best that folks can do is follow public health advice, and for our part, prepare for any contingencies. And so that's what we're doing with now the Office of Emergency Management leaning fully into this coordination. We are thinking about and updating the plans that we've been developing. Plans have existed for months and years that even this morning we've continued to update. Every day we do so. What would we do in the event of a case? What would we do if a person experiencing homelessness were to end up being diagnosed with coronavirus? What would we do in terms of the economic impact? What about if someone who was diagnosed was the breadwinner for their family? Asking those kinds of questions. How do we best coordinate with the school districts? How do we best coordinate with our businesses? That is all the kinds of questions that we're running down. We are also making sure that we reflect the facts of the situation. And so because of the fear that is understandable, there's a lot of misinformation out there. And we're leaning forward very much in trying to keep people informed as to what the truth is. We have created a rumor control site as part of our Ready Harris website, readyharris.org. And there we have continually been updating the rumors that have been swirling and what the truth is to clarify the reality of the situation. Our public health department is continually out in the community pushing the message of what people should do and can do. And so let me get to that. What should each member of our community be doing right now? Of course, avoid travel to countries where there's a high risk of contracting the disease, and the information is at the Centers for Disease Control website, which is also linked out of our Ready Harris site. You also should take the precautions that you always take for any respiratory illness. So, washing hands, covering your cough, having, hand sanitizer, those kinds of things. We know that there have been shortages of face masks. We don't need people to purchase face masks right now. That won't protect folks from coronavirus. And it does keep our healthcare professionals from being able to access those materials that they need. For our part, what we need is continued support, particularly from our federal government, making sure that we have the resources and the testing capacity that we need. So right now, there is an allocation coming down from the federal government. Harris County would be the 5th largest city in the country, Harris County unincorporated areas. And so we need to make sure that we have those resources at the county, at the city of Houston, and that as the testing capabilities become available, that we have that locally. And so I just wanted to take this opportunity to remind folks that we are working to plan for all the contingencies, that it's on each of us to do our part as well, and that we have a network of officials throughout the state and nation that are all coordinating to do the best we can in preparation for this. I was just on the phone yesterday with the county executive at King County in Seattle. I've spoken with executives in other affected areas, and of course our public health officials have done the same, so have our emergency management officials. So we'll continue to stay prepared. If there were to be a case, a diagnosed case, we would notify the community immediately. And so you can be sure that we will do that if that comes to pass. Repito en español. Estamos aquí en una reunión de representantes tanto estatales como nacionales y de varias jurisdicciones a través del Estado de Salud Pública. Y quería tomar esta oportunidad primero para decir que yo entiendo la ansiedad, entiendo el miedo que muchos tienen en cuanto al coronavirus. Sé que es algo pues que lo asusta a uno saber que ese virus sigue creciendo, sigue infectando a distintas comunidades. Entonces yo entiendo, quiero explicar qué está haciendo exactamente el condado Harris para protegernos, para prepararnos, y también qué pueden hacer ustedes, qué podemos hacer cada uno de nosotros como miembros de la comunidad. En cuanto al condado, hoy he dirigido a la Oficina de Manejo de Emergencias que prepare y active el centro de manejo de emergencias en TransStar, como lo hacemos en el caso de cualquier huracán, por ejemplo, y tener ahí, ya tenemos físicamente a todos los socios de varias organizaciones, varios departamentos del condado para poder trabajar juntos en esto. Hemos venido trabajando. Hay planes ya de contingencias. ¿Qué haríamos, por ejemplo, si hubiera un caso? ¿Qué haríamos para el impacto, en cuanto al impacto económico? Si una persona sin casa que vive en la calle se viera afectada, si se viera afectada alguna persona que fuera la única pues, jefe de familia y que tuviéramos que poner esa persona en aislación, ¿qué haríamos con la familia, por ejemplo? Todas esas preguntas, todo eso lo estamos analizando, lo estamos modificando día a día con más información. Hoy en día todavía no hay ningún caso de coronavirus en el condado Harris, pero en cuanto sepamos de cualquier caso verificado, le diremos a la comunidad. Por ahora nuestro departamento está estudiando cualquier caso potencial, también contactando a personas que hayan tenido contacto con esas personas para asegurarnos que este virus no se vaya a esparcir, hacer todo lo posible para que eso no suceda. Hemos continuado trabajando en informar a la comunidad comunidad, hay rumores, entonces hacemos una página de control de rumores en readyharris.org. Estamos coordinando con todos niveles de gobierno. Yo hablé precisamente el día de ayer con el ejecutivo del condado King, donde han habido ya varias muertes por el virus, y seguiremos manejando eso. Lo que quiero decir, pues principalmente, es que estamos trabajando todos, estamos preparándonos, entiendo la ansiedad y necesitamos que la comunidad continúe ayudándonos. Lávense las manos, hagan lo que harían para cualquier virus, o sea, no toser en las manos, no viajar a países donde se sabe que está el virus. Pueden ver la información en la página del CDC. No compren máscaras, tapabocas, eso no protegerá contra el virus y además está afectando la habilidad de nuestros hospitales de poder tener esos instrumentos y esas máscaras que necesitan. Y más que nada, manténganse informados en Ready Harris, en los medios, no preste atención a rumores que no son ciertos. Entonces, concluyo ahí. That is it for me, but we have here, as I mentioned, all of the folks behind me who are happy to answer questions, and I'll also be happy to take any questions.
What would be the case if we had somebody who tested positive in the Houston area, Harris County? Where would that person go? Where would he be treated? Where would they be isolated? A hospital here, somewhere else, San Antonio, a base?
Let me let the doctor answer that question. So, Dr. Shah, thank you.
Thank you. Thank you for that question. And let me just start by saying, Dr. Umair Shah, I'm the Executive Director of Harris County Public Health, and I'm pleased to join Judge Hidalgo and our colleagues from across the country and state, our national association that represents 3,000 local health departments across the country, as well as our Texas Association that represents 45 local health departments. Also our regional health department here with Dr. Plasencia with Department of State Health Services here in Houston, and of course Dr. David Peirce, our EMS Director at the City of Houston, and my colleague as Local Health Authority for the City of Houston. And Dr. Peirce and I particularly have been connected quite a bit over the last several weeks. And as you can imagine, there are a lot of questions that are coming around what would we be doing in various contingencies. And Dr. Peirce and I and our two respective health departments have been working on just that. We recognize that there are a lot of concerns. Some of those concerns are certainly based in what people have been seeing across the globe. Other concerns are related to what people are seeing most recently in other parts of the United States. And we recognize, obviously, there are concerns even related to Texas and here locally. So from a standpoint of if we did have a confirmed case, and I do want to emphasize that we have seen some of that language shifting, especially nationally, from an if to at some point when this would occur. And the reason we've seen that shift nationally is because we're obviously monitoring what's happening in Seattle, what's happening in the Pacific Northwest, and what's happening in California, where there's concern for potential community spread that may be outside of a traveler who, or a link to a traveler who had gone to one of the affected areas. And so when we have a situation like that, really our main emphasis is going to be on the individual and ensuring that individual is isolated from anybody else. Obviously, if that individual requires medical care to the point where they would need to be hospitalized, or if they had more serious symptoms, then we've been working with our healthcare providers so our hospital systems can go ahead and admit that individual and do all the necessary things they need to do in order to isolate and take care of that individual in a more higher acuity state. If we had a situation where that individual is not as sick but did get tested and was confirmed with coronavirus COVID-19, then at that point they could potentially isolate at home, and certainly that we've made arrangements to be able to monitor people at home as well if that's necessary. There are a whole host of additional pieces around this, as the judge mentioned, related to transportation and housing and food and all sorts of other activities that really become wraparound for instances when people are at home versus when they're in an institution, and we're working through those contingencies. I'm going to now ask Dr. Peirce to come up as well, because he and I have actually been meeting with various healthcare entities throughout our system. I think he can provide some additional information.
Thank you, Dr. Shah, and Judge Hidalgo, thank you for your leadership. And Dr. Shaw is right. So we have met, he and I have met, I've forgotten how many times now, at least twice with all of the major health systems, the healthcare systems, and had made sure that they have plans in place and that we're coordinated with them at the event. And as Dr. Shaw pointed out, we are now functioning as if when a case occurs, but hopefully that won't. But should it occur, we'll be well prepared. And so to directly answer your question is our anticipation that any full-service hospital would be able to take care of a patient with the virus that causes COVID-19, and because it is a viral illness, not terribly unlike, in many respects, not terribly unlike the seasonal flu. And we've heard that about this, that there's a lot of symptomology that overlaps, and as the disease progresses, for those who require hospitalization, the care inside the hospital is not terribly dissimilar from someone with the seasonal flu if they should get a very severe viral pneumonia and perhaps a bacterial pneumonia on top of that. So hospitals should all be well-versed and experienced in taking care of patients like this. So we're confident, and here we have the Texas Medical Center, the largest medical center in the world, and we have some of the world's greatest experts in taking care of complicated illnesses. So we're pretty confident that if anyone should become ill here, that they'll be well cared for in Houston-Harris County.
What about the person from Rice University, the staff member? What's going on? How is that person tested? Can you walk us through that process?
Sure. So the question was about the individual at Rice University. And as you know, Dr. Peirce and I and our regional public health departments have been very careful not to add to speculation in terms of persons who might be under monitoring, because we want to make sure that only those individuals who are confirmed, that we are confirming that information to our community. Rice University became a specific instance where Rice University provided some details to the community. Our departments, Dr. Peirce, myself, City of Houston Health Department, Harris County Public Health, as that information came out, continued to work with Rice University to get that, to make sure that the public health aspects of what was happening with this individual were taken care of. So the individual was not on campus, was away from campus, and was continued to be in home isolation, separated from the rest of the campus. And the importance of what we were trying to get across was that at the end of the day, we needed to assure that we had the testing done. Yesterday evening, through efforts of public health, we were able to get the individual to a healthcare entity here in our community, and we're able to get the testing done. That testing means that the samples have been now sent to the CDC in Atlanta. As you know, right now, CDC in Atlanta is where the testing is done. That capability is not at a state, local level here in Texas as of yet. We anticipate that changing. The samples have were sent to Atlanta today. We're anticipating that they will be arriving tomorrow, and then we've been given a timeline of 24 to 48 to 72 hours that we're going to get those results back. And as you know, that the CDC, really a lot of that time frame is really about how much volume they have in terms of persons that are being tested for across the country. I hope that helps.
Is that the only person in Harris County who has received that test?
So we have not been, as I mentioned, not been providing specific information about the numbers, et cetera, but I will say that we've had other individuals that we have certainly been monitoring, and we do this all the time with our healthcare entities, people who are obviously our doctors, our nurses contact the health departments all the time for a variety of diseases, and we do everything we can to investigate with them. In some instances, we have to move to a level of this is really a lower suspicion, and then we rule out very clinically speaking in the public health investigation. Other times we may go to a higher level of investigation.
Does that mean there have been others that have been tested?
There have been others that have been tested. That's correct.
And let me just say also obviously we are, and I'm committed to always erring on the side of information. The concern is if we start keeping an exact count of people and sharing that, folks won't come forward because they'll feel that if they say, hey, I have symptoms, I want to be tested, that they're going to be revealed. And right now what we need is for folks to feel comfortable saying, hey, I may have this, I need to go to the doctor, I need to get tested, and that was our concern. So where we've drawn the line is we will be, as soon as anyone is confirmed as having coronavirus, we will make sure and let the community know. Right now, you know, public health runs down all kinds of diseases all the time, and they come back negative all the time, and it's what's happened so far with the cases we've had. And so that's why, you know, when Rice University put out that these folks had, you know, were being tested, again, for our health departments, it was another routine, you know, yes, folks have been tested, they've come back negative. So these guys, let's wait and see what it comes back as. And what I've asked, you know, our team to do is to make sure that we're running down anyone that these individuals have come into contact with as well, so that in the event that it comes back positive, we know who else they may have been, you know, in touch with. And we've also taken steps, you know, to the best of our abilities to make sure that they're not spreading the disease further. But right now, we haven't had a positive case, and we want to make sure folks continue to come forward.
When we can get test kits, because there were problems with the test kits, so I mean, how sure are we that the people who were tested before are accurate for the test results?
So thank you for that question. I'm gonna defer that to Dr. Peirce. I did want to make one comment about testing, is that we've been made aware of some confusion in the community around coronavirus testing, as in routine coronavirus testing, versus coronavirus testing for novel coronavirus or COVID-19. And so there are some rumors out there that people are saying, well, there has been some testing done here locally that's around coronavirus routine that we have been doing and seeing over the years in the healthcare system. That's not new. But what we're really referring to here is novel coronavirus and COVID-19. To date, that testing is being done through the Centers for Disease Control and Prevention. Dr. Peirce has some additional comments.
Thank you. So the local lab, the local public health lab, is the City of Houston laboratory, and it is a regional lab. It's part of a network of regional labs across the state and actually across the nation. And so the problems that you referred to in terms of the test that came out was the CDC provided testing equipment to a number of labs across the nation. And in doing that, when that comes, there are some, what you have to understand is that this is not a simple test. We're actually testing for the DNA sequence of the virus. And so it is actually a fairly high-tech test. And the laboratory and the technicians in the lab have to go through a number of verification processes to make sure that the test is working properly. And that's what was found out across the nation, was they're called primers, and there's 3 primers. And the 3rd primer was not responding the way it had been expected to respond during the testing phase. And so that was the quote-unquote problem. That test had not been used clinically on any patients when the issue was uncovered. So all of the tests that have been done on patients have been ones that have been done at the CDC lab, and so there's we know that those are done properly, and the testing sequence and the method of testing at the CDC is accurate. But when they tried to get it out to the local labs, it turned out there was a problem with that 3rd primer. But those were not used on any patients, so we have 100% confidence that the patients who have been tested, the individuals, that we should say, I shouldn't call them patients because they all tested negative. So the individuals who were tested, that we have 100% confidence that those were all accurately negative tests.
Will we get tests, any new tests being shipped to Houston?
Yes. So in fact, the FDA yesterday came out with some change in their regulations that are going to facilitate getting the lab testing up and running for labs like ours, part of the regional lab networks across the nation, and also some of the academic labs that also already have the capability to do this type of testing. Because like I said, this is actually fairly high tech. It's looking for the DNA sequence. This is not the sort of thing that is commonly found in just any kind of laboratory. You have to have the right equipment and the people who are properly trained. So they're moving very hard to get that up, because clearly at the national level they recognize that we need to get to expand the testing. So as Dr. Shaw pointed out, we're already looking at several days, up to 3 days delay in getting results back, and that's simply due to the volume that the lab in Atlanta is dealing with. So there's every reason to try to get that up. However, as we talked earlier, since we already came across an issue, it does no one any good to get a test out that is fallible. So we got to balance getting the testing availability out across the nation, but at the same time making absolutely certain that those test results are going to be accurate. So that's what the CDC is trying to balance right now, and they're working very hard, and I'm very happy with the effort that they're putting forth. And we're hoping that within the next week to 10 days or so, maybe sooner, maybe later, we'll have to wait and see, but there's every effort to get that testing enhanced, that testing capacity enhanced.
Do you know how the rumor control is going? I know it was a major issue in Chinatown just a couple weeks ago, and now I've been sent a number of screen grabs of people talking about coronavirus is here. It's at Methodist, and you all aren't saying anything because Rodeo Houston starts tomorrow. So if you could just give us an update on how the rumors are handling, and then if you could address that one specific point.
Of course. First, it's understandable. As I mentioned, folks are nervous. They read something, and I don't think there's ill will behind sharing something that's not verified. And, we've had a lot of visits to a rumor control site. It's not going to bring it down to zero, but we need to, everybody's help to continue to spread the information that is factual, to remind folks that if they have a question, they can go to Reddy Harris and check the rumor control site. Send us questions folks would like us to address. Absolutely, I don't want to lend credence to any rumors out there. What I'll repeat is that if there is a positive case in Harris County or Houston, we will absolutely share that with the community. Right now, we are having conversations around the rodeo, of course, and so far, because we don't have any cases, it doesn't make sense to do the assessment everybody did is they're going to do additional hand sanitizers and encourage people to take precautions, but we'll continue to review, as the situation continues to evolve, does the posture need to change in any way, shape, or form? I will also say that it's important to remember there's not additional risk of contracting the virus when folks visit Chinatown. Our businesses there are still suffering. If we end up being impacted, of course, that's going to have an economic impact, and that's some of the questions we're thinking about, how to preserve continuity of government, what recommendations we would give our businesses. But for right now, the recommendation is we are working on all of those contingencies, and the community needs to take the precautions they would take with any respiratory illness, and needs to keep themselves informed. So I really ask people to check again before they share something they saw online, because even if we don't intend to do it maliciously, it does end up harming the community. It spreads unnecessary fear, and it hurts some facets of our community.
Along those lines, you guys been saying, is there any specific myths that are out there or common things you're hearing that you can say for sure are false, or any myths you can bust that come to mind?
So yeah, I mean, I'm hesitant to sort of, echo things that are wrong. So I would direct folks to a rumor control site. What I want to make sure people do know is there are no confirmed cases in Houston or Harris County right now. There's, as yet, no vaccine for this virus, and so we need people to wash their hands, take the normal precautions they would do with any other illness, and we are preparing, we are coordinating as far as the test kits. As Dr. Peirce mentioned, we hope to receive capabilities locally through the Houston lab to be able to test locally, and that's where it's very important that we receive federal funding to be able to have enough capacity. And so we're working with our legislative delegation to make sure that funding comes not only to the city but also to the county, because we have to look after the unincorporated areas of Harris County, which have an enormous population. Dr. Shaw, did you have something to add?
Yeah, thank you, Judge. I just wanted to add that I agree that we do not want to act as an echo chamber for misinformation, but we do want to act as an echo chamber for factual information. And the facts are that if someone in the community is concerned that they have been exposed to a confirmed case, or they've traveled to one of the affected areas and they're concerned about that, we want them to contact their healthcare provider. And we want that healthcare provider, and this is what we've been doing on the back end, behind the scenes, we've been sharing information to our healthcare system. So our healthcare system is also aware of what's happening, the information from a national level and information here locally, so that they understand evolving guidance. And the guidance has evolved, because obviously initially we were thinking China, and then it moved to additional countries, and now we're also getting information about what's happening across other parts of the globe and also domestically. So we're saying contact your healthcare provider. We want that link to be strong. We want our healthcare provider linked to be strong with our individuals in our community, and then certainly the healthcare providers are going to be working with the area health departments to really assure that we've got the right thing going in place. And let me also say, this is the reason that you have all of us up here, that you have folks from our state, you have individuals from and representatives from our Texas Association of Health Officials, you have our National Association of Health Officials. The message we're giving here is that this is not a local, regional, or state or national issue, it's an all of us issue. And we have to all do the things together in order to protect ourselves and prepare ourselves from novel coronavirus in the future, and certainly do all the things today so we can protect ourselves from other kinds of viral illnesses that are in our community. So I just wanted to add that.
Yeah, and let me add also to your point, Dr. Shah, this is another thing that we're relying on each person in our community for, is if you feel that you may have the virus, we need you to call your doctor, right? Try not to show up, because, again, we don't want it to spread. And so it's very important for anyone who doesn't have health insurance, you can call 211. They will direct you to a doctor that can see you without insurance. And then for anyone who is undocumented, our public hospital system, Harris Health, will receive your case that will not ask about immigration status.
Any screening going on at the Port of Houston? I mean, you've got ships coming in from all over the country. Is the Coast Guard getting involved? Is this something that
I think the Coast Guard is making the sandbox.
Yeah, Dr. Pearce may have some additional information, and Dr. Plasencia may have some additional information, but really the Coast Guard is, again, national and, federal, and working with state, local officials. And so ships that are coming in this case, going to the ship channel, the Coast Guard is handling the responsibilities of assuring what's happening from that ship, whether it's the cargo or certainly the people that are on that ship. And unless Dr. Pearce, Dr. Plasencia, any additional? Is that okay?
Yeah, we are, obviously our Office of Emergency Management is on this, and those are all the partners that we're bringing together now at TransStar to more formally coordinate, but we've been doing this for the past few months.
Is the closest case that you guys are aware of in San Antonio? As far as
Yes.
geographically?
Yes.
Is what's happened there, is that a cautionary tale? I mean, someone had 2 negative tests, and then they let them go, and they were all. I mean, how concerning is it?
Yeah, so thank you for that. I think it's important for us to just remind our community that, look, we are watching what's happening here locally, we're watching what's happening across the state, we're watching what's happening across the region and the country, certainly we're watching what's happening globally. And so there are impacts to our local community, not necessarily physical impacts, but the perception impact. And so we know that when there is a ripple effect, when something happens, there's a ripple effect in our local community. But yes, what we're watching is what's happening in other parts of our state. That's the most proximate place where we're going to have potential for concern. And then we're going broadly to what's happening across the country. So what happens is really, from our standpoint, when we are made aware of what's happening with our local health officials across other parts of the state, we're sharing with each other. And I think that's the name of the game. It's communication, it's coordination, it's collaboration. We're sharing across the system so we can learn from each other, we can learn best practices, but we can also understand how people are dealing with things. As the judge mentioned, with her contacts with Seattle-King County, as well as our contacts with Seattle-King County Public Health, we're also understanding what's happening in their area, and we're also utilizing that as our planning continues here locally.
I hate to pick on the rodeo, but I mean, a lot of people have the rodeo on their mind right now, obviously, and a lot of people are going to go tomorrow. Any words of help with them, you want to impart on them?
Sure, and I want to, again, the question is about the rodeo, and Dr. Pearce is here as well. And I would say that our most important piece is that, look, if you're going to the rodeo and you're sick, we want you to not go to the rodeo, just isolate yourself at home. We also, by the way, don't want you to go to school. We don't want you to go to work. We want to make sure that if you are sick with symptoms of a respiratory nature, that you are staying home and isolating yourself so you protect yourself, your loved ones, but also the community at large. As earlier Judge mentioned, working with the Rodeo as well as the City of Houston working with the Rodeo, this is a shared city-county set of activities. We are very proud of the Rodeo. It's one of the best in the country. Some people say it's the best in the country. I really want to say that there are efforts that are in place there, including with additional hand sanitizers and really signage that really we want to make sure that our community members that are going there, they enjoy the Rodeo, but they also protect themselves and those around them. David? Yeah.
Yeah, just want to echo a couple things and then remind some of us of something else that helps to put this in perspective. So there are no cases here in Southeast Texas, therefore there's no reason for any changes at the Rodeo. What does need to change, however, is that all of us need to start paying attention to our personal habits and our personal behaviors. And to put this in perspective, if you think about epidemics that we've had in just in the last couple of decades, to include MERS and SARS, which are coronavirus also, and Ebola, which is not a coronavirus, but nevertheless there was an epidemic. And if you think about those, you'll recognize that there was no vaccine that stopped those epidemics. There was no magic pill or treatment or medicine that stopped those epidemics. What stopped those epidemics, what stopped the spread of those, was really Herculean effort on the part of public health to identify cases so people felt comfortable coming forward. We were able to identify cases and then isolate those cases and do the appropriate quarantining. But more importantly than that, what stopped those epidemics was people washing their hands, covering their coughs, not going to work when they're ill, and following those personal hygiene things that we've been talking about again and again and again. I want to remind you, with SARS and MERS and Ebola, there was no vaccine, there was no magic treatment. It was really aggressive public health combined with the populace following the lead of what public health was trying to tell folks. And if you look carefully at the Ebola situation and you follow that carefully, you'll see that part of the reason why it got so big was that there was, in the beginning, there was a big mistrust of the government in those countries. And once they started to believe what the government was telling them about how to stop the outbreak stopped. And this one will be probably the exact same evolution. And so the other thing I want to put in your mind is, remember when H1N1 started? We were having the exact same conversations when in 2009 with H1N1, and in the end it turned out that the virus really was no more severe than the seasonal flu, but for quite a while there, the numbers were looking like it was going to be a really horrible virus. And right now, that's the situation we're in right now. We're looking at some numbers that have got us all a little antsy, but we also recognize that the denominator that we're using when we start talking about case fatality rate, that we may be way undercounting cases, because the only cases we're able to count now are people who come forward. And so again, going back to why we don't talk about suspect cases and who we've tested and how many, is because that instills a level of fear in the community that is completely counterproductive to us being able to know what the facts are. So I hope you will bear with us and understand we are not going to talk about those things because it changes the environment in the community. The community has to feel comfortable with it. If they come forward, their identities will be kept in strict confidence, and so that people feel comfortable coming forward. So talking about those things has the exact opposite effect and would actually create the situation we saw in West Africa and make the situation a whole lot worse. So that may be a little bit complicated of a message, but I hope it gets across. So the reassurance that the things that have stopped epidemics in the past are things which are in the hands of every single resident of Southeast Texas, and that's to wash your hands, cover your cough, clean those commonly touched surfaces, and if you're ill, please do not go to school or to work or to large gatherings, but stay home, stay in your room, try not to infect your family members, try not to infect your coworkers, try not to infect your neighbors. You should be doing this every year during the flu season anyways. These are things which, unfortunately we take the flu as a relatively mild thing. It happens every year, yet 40,000 Americans die of the seasonal flu because we are not obsessive compulsive about those things. So here's another virus that's come upon the planet that reminds us we need to wash our hands, cover our coughs, Don't go to work or school if you're ill. Thank you.
Is warmer weather a friend with this particular virus, or is that unknown yet?
So the question about warmer weather, our friend with this virus, we don't know yet. I mean, this is a novel virus. It's a new virus. It was discovered in December of 2019. It's too early to tell. And I think that brings up a great message, which is that a lot is unknown and a lot is known. And so we're doing our best to really assure that we get the information out of what we know. And where we don't know, we're saying we don't know. And so the answer to your question is we don't know. We're hopeful. Because, you know, in Houston, summer comes pretty quick. So we're hoping that that is the answer, but we just don't know at this point. And so I think it's important for us to continue to stay with the science, as the judge mentioned, the facts, and make sure that any rumors that are out there, that we continue to fight those.
It's not shown up much in the southern hemisphere, right?
Say that again?
It's not shown up much in the southern hemisphere.
Australia and Singapore cases,
Yeah, I was just going to say that there has been, hi Todd, there has been in Australia and Singapore, we are, you know, we've now seen some cases that are in Brazil and Mexico and certainly now in Nigeria. So it's not, and obviously in South Asia as well. So it's not a necessarily temperature dependent piece that we're aware of, but we're doing everything we can obviously to monitor. And we anticipate as we get through some period of some additional periodicity of the seasonality, we're going to get more information about this virus as well.
Just
Let me-
researcher, can you tell us anything about the person's age?
On this point, before we move to the next question, I do want to highlight the attention that the departments are both placing on research. And so there are a lot of conversations going on about what we do know, what we don't know, and what's being learned in communities that have had the virus diagnosed and already in their communities. And so that's something that I forgot to mention earlier, and it's we're truly trying to learn and listen to the experts on this. You were asking a question about
This Rice research staffer, can you tell us anything about the person? We don't even know the person's gender. Is it a middle-aged person, male, female, any underlying health issues?
Yeah, so again, this is one case that folks, shared that we don't know yet if it's positive or negative. We've had several of these that have come back negative, and we didn't share information about those individuals because we didn't want to frighten folks from coming forward, feeling like if they come forward, suddenly their information is going to be all over the news. And so, if this ends up being a positive, and we hope it won't, we're awaiting the test, we will inform the community, and at that point, the relevant details will come out. But it's just like any other case that has been tested right now. There is no positive. It may as well, and hopefully will just be something that came and went like other ones that have. Yeah. Yes, well, do you want to say that again?
Yeah. So again, as a reminder that the test was done, testing was done yesterday. Yeah. So just a reminder that the testing was done yesterday. Samples were collected yesterday. They were shipped today to the Centers for Disease Control and Prevention in Atlanta. And they should be arriving there tomorrow, and then we'll know based on what the CDC in terms of their timeline. For testing right now? Yeah, right now the testing is in Atlanta at the Centers for Disease Control and Prevention only, but as Dr. Peirce mentioned, that we are hoping to be able to see that change over time so that there is more local testing that's occurring, or at least testing that's happening at a state level, and certainly we don't know how quickly that's going to expand. Well, so again, if the test results arrive, test samples arrive by tomorrow, we should anticipate 48 to 72 hours. So it's somewhere midweek that we would anticipate results.
So by the time the patient is waiting for the results, where is the patient? Is he staying at home or staying in the hospital?
So again, this individual, we don't want to get into too many specifics, but just to say that we're taking the appropriate measures to assure that that individual is
Safe, right?
that's right. Yeah.
Is it free or is the test
Right. So as I'll refer you to our statement from yesterday, as well as the statement from Rice University that that individual is self-quarantined, and so there is at this point no symptoms that are really of significant concern. And what we're doing is really doing our best to continue to follow the information as it unfolds. We don't have all that information from a standpoint of testing, but we do have our epidemiologists are in contact with both the individual as well as Rice University, so we continue to follow that with them.
Yeah, we have some readers asking if the test is free, you know, or if you just call the healthcare, if you have a insurance or not, and then you go, is it free?
Yeah, so that's a really good question, and this is about testing and the price of testing, and Dr. Person and I had this conversation just earlier because there was a rumor that was out there related to the cost of a test, and then individuals in the community, and back to the judge's point about the fact that there are folks out there with rumors or spreading some of the rumors. So the concern is, what is the cost of a COVID-19 test? And really at this point, the way this is being set up and has been set up over the last several weeks is that it's a combination of the healthcare provider as well as the public health department coming together and making a decision based on the information of that individual, whether this individual, any individual, needs to be tested. And if that's the case, then that test is being done and conducted without a thought about the cost to that individual, because what we're doing is that test is being sent to Atlanta, and the Centers for Disease Control and Prevention is not, as far as I know, not charging back to the individual, but really as part of the system so that we can do the appropriate epidemiologic surveillance and understand if there are more people that are testing in either positive or negative. So that test does not have a cost, Dr. Purse.
So we need to wrap up. We got to get the judge to the next
Sure.
location, but Dr. First and Dr. Shaw will be available for follow-up if you want to.
Yeah. Yes.
Dial 211 if you don't have health insurance and undocumented immigrants.
Yes, so if you don't have health insurance, and this gets to your question as well, you can dial 211. They'll connect you with organizations and healthcare providers who will take you and refer you to a test if necessary. If you're undocumented, you can show up at any of our county public hospitals, and those will not ask about citizenship status. And as we know about other hospitals that don't ask, we'll share that. We, of course, encourage hospitals not to ask about citizenship status. Right now, we need people to call the doctor and then follow those instructions. And we're tracking our the potential cases as best we possibly can, and hopefully they'll come back negative. Again, if we get a positive, the community will be the first to know. Thank you, guys. Yeah. Well, I'm gonna head out, but I'll leave Dr. Shaw and Dr. Purse. Oh yeah, why don't we do that? Yeah, we'll do one-on-one. Thank you.
Watch it.
Does anyone have questions, Dr. First and Dr. Shaw?